Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
But I have to say, I think the next generation of trials are going to be all about targeting the particular Achilles heel of an individual woman's cancer.
Good afternoon and welcome to Rex on Call live from WRAL. I'm Kim Dean for Rex Healthcare. October is Breast Cancer Awareness Month, and no doubt you've seen pink ribbons, pink products, even NFL players wearing pink to raise awareness of the disease. It's a disease that affects 1 in 9 women. 1 in 9 women will be diagnosed with breast cancer. But just in the last few years, there have been some real advances in what we know about breast cancer, and much of that has come from the researchers at UNC. Today, our experts will be answering your questions on breast cancer, from detection to treatment. If you have questions concerning breast cancer, our operators are standing by to take your calls. Call local here in Wake County at 744-3876, and outside of Wake County, give us a call toll-free at 877-277-6252. Your questions may be answered here live on our program by our experts. The doctors answering your questions on breast cancer today are oncologist Dr. Lola Alajide and radiologist Dr. Julie Tabor. To phone us here at Rex on Call, again, just dial that number on your screen in Wake County, 744-3876. Outside of Wake County, 877-277-6252. Again, that's for Rex on Call. And if you're watching us live on WRAL.com as we're streaming, you can give us an email. Go to WRAL.com, search for Rex on Call, and send us an email. While you're calling in with your questions, we want to introduce you to Dr. Lisa Carey. We'd run out of time in this program listing her accomplishments and in the field of cancer research, but quickly, she's an internationally recognized breast cancer physician, the medical director of the UNC Breast Cancer Center, associate director of clinical research at UNC Lineberger Comprehensive Cancer Center, and she is leading the way in what we know about different subtypes of breast cancers. And now she's leading multiple clinical trials that will change the way breast cancer is treated.
In the not-too-distant future, Dr. Lisa Carey predicts doctors will be able to identify a patient's breast cancer and know exactly how a tumor will respond to treatment.
Instead of treating groups of patients, we actually were personalizing the care. You know, if we have a menu of treatments and we're matching them directly on an individual basis, that's the future, and that's what we'll be talking about 10 years from now.
And that starts in clinical trials she's leading now. Carey has participated in research that has shown us breast cancer is not just one disease. There are at least 5 different types of breast cancer. In fact, she's a worldwide expert in what's called triple-negative breast cancer.
The problem with triple negative, and the reason it has that name, is it doesn't have estrogen receptor, progesterone receptor, or HER2, which means we're totally reliant on chemotherapy to treat it. Interestingly, it's also a kind of cancer that's seen more in young women who get breast cancer and African American women who get breast cancer. So it's a kind of cancer that's harder to treat and happens in groups that already have, a disadvantage.
That's why it's so very important to find new, targeted ways to treat this type of breast cancer. And that's why her new clinical trials are so important. And the collaboration between UNC and Rex Cancer Center is invaluable.
The Rex Cancer Center has, terrific clinicians, a terrific patient population, and it's different from the UNC population. So in a sense, this is a true partnership where you can take thoughtful ideas. They can be vetted across the 2 institutions with trials that are deliberately designed to serve, kind of the group, and we can answer questions faster.
Questions like why breast cancer develops in one woman and not another, why some breast cancers respond better to certain drug therapies. The answers, Dr. Carey believes, lie in clinical trials and cooperation.
The key thing for breast cancer and frankly all cancer research going forward is going to be the ability for researchers to play well in the sandbox with each other, to collaborate, and to do studies across a group of essentially, partners. That's going to be the key to us kind of continuing this trajectory. Otherwise, we're going to stall.
And joining us now is oncologist Dr. Lola Alajade and radiologist Dr. Julie Tabor. And then we're going to get right to our questions here. We've got a lot of them coming in. We talked a lot about the advancing treatment in that piece, but let's talk about diagnosis. Dr. Tabor, what is right now the best way to diagnose breast cancer?
Screening mammography remains the best and really the only way of diagnosing breast cancer at an early stage.
But what about breast MRI or ultrasound?
Ultrasound is really used as an accessory tool if someone comes in with an issue or you see a problem on a mammogram. An ultrasound is used to further evaluate that abnormality to see if it's solid or it's cystic and if further evaluation is needed. But as a screening tool, it has been used, but it's not as effective as mammography.
Okay, and Dr. Alajade, when do you believe that a woman should get her first mammogram?
Most schools of thought are that at the age of 40, you should have your first mammogram, but it also depends on your family history. Certain risk factors, genetic mutations, may predispose women to getting breast cancers at an earlier age. So if you have a strong family history of breast cancer, several first-degree relatives, you should talk to your either gynecologist or medical internist about when you should be screened.
Now, and I've talked to folks out there, they said, my grandmother has had breast cancer, but my mother has yet to develop breast cancer. Is that count as a significant enough family history to get an earlier mammogram?
In general, if you have a first-degree relative that is postmenopausal or very advanced in age, the likelihood that you have a genetic mutation in that family with no other family members having had cancers of any kind is low. Only about 5 to 10% of all breast cancers are due to a genetic mutation, so it's a small percentage.
Okay, and what do you know about in terms of family history of other types of cancer, like colon cancer or ovarian cancer, and what does that do to your risks of breast cancer?
So again, the genetic mutations that are most commonly associated with breast cancer are the BRCA mutations. There's a BRCA1 and 2 gene that are usually linked with breast and ovarian cancer syndromes, so multiple family members with young age of diagnosis of breast and ovarian cancer. Some of these groups of individuals have pancreatic and prostate cancers in those families, and there has been a link with colon cancer as well. So it all ties together, and not just the maternal risk. Paternal risk is also important.
Okay, and Dr. Tabor, it's important to know that women aren't the only ones that get breast cancer.
No, they're not. Breast cancer is very uncommon in men, but it does occur, and any man who develops a suspicious finding such as skin thickening, any changes in the nipple or a lump in the breast should seek evaluation of that from their physician.
Okay, great. We're going to be back after the break to answer some more of your questions. Our operators are taking questions about breast cancer, everything from early detection to successful treatments. Call in now in Wake County, 744-3876. Outside of Wake County, call us toll-free, 877-277-6252, or submit your question online. Go to WRAL.com, search Rex on Call, or on Twitter, we're at Rex Healthcare. Use pound Rex on Call. Your questions may be answered live on our program by our Rex experts. Patients with advanced forms of breast cancer, what may be done to reverse the trend? And later, it's been discovered that different types of breast cancer affects younger African American women more than any other group. We'll tell you what one special group is doing to educate all women on breast health. Welcome back to Rex on Call live from the WRAL studios. Today we're answering your questions about breast cancer. If you have questions for our experts, call now, locally 744-3876 or toll free 877-277-6252. You can also email your question. Go to WRAL.com and search Rex on Call or send us a tweet at Rex Healthcare using the hashtag Rex on Call. Let's take some questions right now. This one is from Juanita. She says fibroid cysts in her breast are hurting. Is there something other than cysts that may be causing this pain?
And it's hard to know exactly what breast pain comes from. A lot of women have fibrocystic changes in their breasts that is cyclical. It changes with their cycle. Some women have breast pain all the time. It's important to go seek evaluation from your physician to make sure that there is not a specific large cyst that's causing the pain. Also, cancer can cause pain, but it's very uncommon. Typically, it presents with other findings. But it is a good idea if she has not had an evaluation yet with her baseline mammogram or other evaluation to see her doctor to see if there may be something else. Usually it's just the fibrocystic change.
Okay, and this question is from Karen. Her sister-in-law passed away in May of 2001 from breast cancer, and there is breast cancer on both sides of her family. Does that increase my daughter's chances, she wants to know?
It potentially could. It depends on the age at which the other family members were diagnosed with cancer and specifically what type of breast cancer. But again, as mentioned, the risk for genetic mutations can happen both on the father's or the mother's side of the family. So if there have been multiple cases, it's really important that she, I guess, assess with her daughter and her daughter's pediatrician, depending on the age her daughter is, or internist or gynecologist, what that family risk truly is and whether it warrants extra screening.
And or earlier
or
screening.
Earlier screening.
Okay, and this question is from Sue. Does fibrocystic disease make you more susceptible to breast cancer?
No, it doesn't.
No is the short answer.
No.
Okay, any extra monitoring she needs to do? Anything else she needs to know? No? Okay, that was an easy answer. This one's from Connie and Carrie concerning mammograms. Do you have to have a doctor's order to have a mammogram, or can you just go to a radiologist and have it by yourself?
Some facilities do not need to have an order from a physician, but there typically needs to be a physician that a report can be sent to. And the reason for that is that if someone comes in and does not have a physician to follow up, sometimes it's hard to get a hold of that person if there is an abnormality, and you want to make sure that she's got someone to take care of her if you find something wrong. So it's possible, but it's better to get with a physician and have them order those studies for you.
Okay, absolutely. Now, as it turns out, there is another devastating side effect from the downturn in our economy. Doctors are seeing more and more women with advanced stages of breast cancer. Doctors believe these women are neglecting mammograms because they are uninsured or underinsured. And without this screening, many small treatable cancers are growing with detection. We did talk to a doctor that said she explained if there's easy access to health care, including screening, that they were seeing women that were taking care of those small treatable cancers, but without it, many women are just really missing that opportunity. There are ways to get free mammograms. So here they are. It's a program supported by the Triangle affiliate of the Susan G. Komen for the Cure and the Rex Healthcare Foundation. Call that number on your screen. It's 919-784-6186. Select option 3. Women can call that number to make sure they can qualify for a free mammogram. And again, don't confuse that number with our number here at Rex on Call. Coming up, we're going to answer more of your questions on breast cancer from detection to treatment. Give us a call here in Wake County at 744-3876 or 877-277-6252. Email us your questions by going to WRAL.com, search Rex on Call, and send us an email. We'll be right back. Welcome back to Rex on Call, live here on WRAL. Before we get to more of your questions, we have some big news to share about efforts to make mammography services available to everyone. It's been a busy few months with the Rex Mobile Mammography Unit, including a trip to New York City, and there's a completely new unit on the road. First, Revlon invited the Rex Mobile Mammography Unit to NYC for the 14th Annual Entertainment Industry Foundation Revlon Run Walk for Women in April. The unit served as a symbol of efforts to make mammography accessible to all women. Last year alone, the Rex Mobile Mammography Unit has referred nearly 30 women for biopsy and diagnosed 5 women with breast cancer. The cancer in these women may otherwise have gone undetected. Revlon funds operation of the unit and the state-of-the-art digital equipment inside. And now take a look at this. Here's the newest addition to the Rex Mobile Mammography family. This new pink unit, like its older sister, is equipped with the latest digital mammography equipment. These mobile units are the only ones in the area. Businesses and other organizations have found this to be a convenient option. You can inquire about a site visit visiting rexhealth.com or calling 919-784-4210. Again, not to be confused with our number here at Rex on Call today. You can call us at 744-3876 in Wake County. Outside of Wake County, 877-277-6252. And of course, you can email us your questions. Go to WRAL.com, search Rex on Call. Let's get to those questions. This one's from Vivian. How often should you have a lump checked?
Well, there's a long answer and a short answer. Initially, when a lump develops, it should be fully evaluated. It should be evaluated by your physician with a physical exam. It should probably also be followed by a mammogram and an ultrasound depending on your age. Now, once a lump is found and it is determined to be normal breast tissue, a lot of times those can increase in size and decrease in size, like the fibrocystic changes with women's cycle. As long as they keep a check on it, make sure that it's not increasing and that it's fairly stable, that's fine. If the lump becomes different in any way, if it becomes much larger, if it becomes fixed, it's not freely movable, then at that stage probably another evaluation should be performed.
Okay, this question is from Anne. How often should she have a mammogram? She's 71 years old.
Well, again, it depends who you talk to, but the standard recommendations, which are from the American Cancer Society, and a lot of other societies follow suit with that. Starting at age 40, you should have a mammogram yearly. The upper age level is not definite depending on your health. It may be if you're 80 years old and you have no other health problems that you should continue to get mammograms. Probably after the age of 90, they're not necessary because something that would be found may not be something that impacts your life.
Okay, this is from Kayla in Rocky Mount. Can an MRI detect breast cancer? If not, what can it tell?
MRIs can tell a lot of things. They can detect breast cancer. They also can detect cysts. They can detect fibroadenomas. The problem with MRI is that it's very sensitive. A lot of things, we look for enhancement. We give a contrast agent and things in the breast enhance. Breast cancer enhances, multiple other things enhance as well. So it's very sensitive. It finds a lot of things, but not all of those things are cancer.
Okay. This one is from Cynthia in Fayetteville. When should your daughters begin to have a breast exam? And her child has both grandmothers with breast cancer. So when should she start getting mammograms? So when would a first breast exam, and then when's a first mammogram? Do you want to take?
Well, we usually recommend that all women start having clinical breast exams at age 21. So you should be going in to have a medical professional examine your breasts annually at that point. And in terms of when to start having mammograms, again, unless there is a very strong family history of 2 or more first-degree relatives at young ages or premenopausal ages of diagnosis of breast cancer, you should not really be needing to go in before the age of 40 for a mammogram.
Even with grandmothers, you're saying that doesn't count as a first-degree?
It depends on when the grandmothers were diagnosed, and again, what age they were at diagnosis. If the grandmother was 60 when she was diagnosed and there was another family member with breast cancer as well, that would be concerning. If you happen to have grandmothers diagnosed at age 70, then it's unlikely that that history impacts your own personal history of cancer.
Okay, anything to add to that, Dr. Tabor? Very good job there. Okay. Breast cancer impacts people across all racial boundaries, but research shows there's a subtype of breast cancer that affects younger African American women. That's Rex Cancer Center outreach called Save Our Sisters has stepped in. Here's one of the volunteers, Grace Wright.
Well, we have medical statistics that shows us more white women get breast cancer, but more black women die from breast cancer. And here again, we can only say that it is because of the lack of screening, the lack of knowledge. A lot of us as African Americans don't know our family history.
Has been volunteering with Save Our Sisters of Rex for more than 15 years. She is one of the many specially trained volunteers working to educate all women of all ages and races on breast health issues, including the importance of self-exams and mammograms. For more information, or if you'd like to volunteer with Save Our Sisters, call this number. It's 919-784-6247. And coming up, we're going to have a final round of questions here. This is Rex on Call. Welcome back to the show. This is Rex on Call, and we're taking a final round of questions here. Let's get right to it. This is a question from Raleigh. As breastfeeding children, can that affect your chances of getting breast cancer?
In general, if you have children or start to have children at a very early age, and if you have multiple pregnancies, that can reduce the risk of breast cancer. However, people always also look into the issue of breastfeeding after having met multiple children. Breastfeeding also delays the onset of regular cycles and exposure of estrogen and so forth to the body, so that can further reduce the risk of breast cancer occurring. So in general, we do recommend, or we don't recommend, but people that have multiple pregnancies or have breastfed for a long time have a lower chance of getting breast cancer.
And I have talked to several people who are currently nursing, and they've had a baby, and then they nursed, and they had another baby, and they nursed, and they went many, many years. Can you get a mammogram while you're breastfeeding?
You can. The problem is there's very dense breast tissue usually because of just of the way the breast develops during the nursing process. And so it's very difficult to see anything through the dense tissue. So we typically recommend that someone has been stopped nursing for approximately 3 months prior to getting a mammogram.
And even if, there are women who are they're pregnant or nursing for a long time.
Well, if they're, I would say more than 2 years, you can try and see the density of the breast tissue because everybody's different.
Okay.
Also, if someone develops a lump while they're nursing, that should be evaluated. They shouldn't ignore anything.
Okay. And this is a question from Kira. Do teenagers get breast cancer?
The incidence of breast cancer under the age of 30 is extremely low. However, there are very young women that have been diagnosed with breast cancer, mainly in association with certain genetic mutations. So the take-home message should be that anybody who finds a lump or unusual changes of the breast should present for evaluation.
Okay. And this is a question from Betty, wondering if the estrogen she's taking is going to increase her risk of getting breast cancer.
Estrogen in the Women's Health Initiative study, combined estrogen and progesterone did increase the risk of breast cancer after about 5 years of continuous use. So hormone replacement therapy can increase the risk of breast cancer, but there are different types of hormone replacement therapy. Single agent estrogen has not really been linked to a high risk of breast cancer. However, again, you have to take into context how long you've been taking it, what the formulation of the hormone replacement therapy is, and that may change the answer for different people.
Okay, so this is not, there's not one...
There's not one blanket answer. However, in people that do require hormone replacement therapy for very significant symptoms of menopause,
right,
it's acceptable but typically not recommended for more than a specific amount of time.
Okay, and this is a question, she had a bad injury to the breast, and she got a mammogram to check it out, but still hurting. Should she how should she keep monitoring this?
Well, typically, so after trauma to the breast, and particularly we see this in women who've been in car accidents and have seatbelt injuries across the breast, they can develop small hematomas, collections of blood from the trauma from the seatbelt, and then that can develop into something that's called fat necrosis. It can be a hard lump that develops afterwards, and some women are very alarmed by it. It's important to go seek medical care, have a mammogram, and possibly an ultrasound to evaluate that. The pain itself, once it's been determined that everything is fine, the pain may be due to just a long healing process from the injury.
What lifestyle changes do you recommend to women to prevent breast cancer in the first place?
Well, only a few things have actually been proven in randomized studies to reduce the risk of cancer, and with breast cancer specifically, regular exercise has been shown to be beneficial, particularly for postmenopausal women. It's not just the weight loss that's important, but also just the regular activity. We also know that decreased amounts of saturated fat in the diet can modulate your risk as well, so we do advise our patients to cut back on the amount of saturated fat specifically in the diet. There have been controversial studies about vitamin D and breast cancer risk. What we do know is that women that were diagnosed with breast cancer, when compared with those that were not in a specific study, the ones that did have regular levels of vitamin D at times of prior to diagnosis were less likely to develop breast cancer. So vitamin D supplementation is something that, under the guidance of a physician, may be necessary, but right now we don't have strict guidelines about that.
Okay, and as always, consult with your physician about any health concerns. And thank you guys for your insight today, Dr. Lola Olajide, Dr. Julie Tabor. And thank you to our phone bank for taking those calls. They're still taking calls. And we'll make sure to get back to you if you've left a phone number where we can reach you. Join us on Monday, November 21st for our next Rex on Call. We'll be talking about knee and hip replacements. We'll talk with orthopedic surgeon Dr. Bradley Vaughn. Join us then.
Has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.